I like to talk about the antacid medications called proton pump inhibitors. When they came out, physicians thought they were a godsend. They thought they were amazing. We were told they were totally safe, no side effects, and they have been given out to all sorts of complaints. Anything above the waist and below the top of the head gets treated with a PPI. PPIs now, we're noting, have some fairly significant side effects. On the label right now, there are 3 warnings. One is that without acid in your stomach, you don't absorb calcium well, so there's increased hip fractures, back fractures, wrist fractures. Without acid in your stomach, you don't ionize and absorb magnesium well, so there's more cardiac arrhythmias and a fibromyalgia type state. And in 2012, they put a warning label on it. Without acid in your stomach, you lose part of your immune system. You know, your acid in your stomach is your bug zapper. It kills the spores of the viruses and the yeast and the bacteria that you swallow. And if you're on one of these medications, that doesn't happen. In the last year and a half has been an especially bad year for the drugs because there have been 4 major articles come out. The first one was out of Canada. A large number of patients followed for over 20 years, and they showed a 50% increase incidence in chronic renal failure. And then there was a large study out of Columbia Presbyterian in Stanford of over 20-year follow-up, large number of patients, and they showed an 18 to 21% increased incidence of heart attacks. And then very recently there was 70,000 patients followed 20 years in Germany with a 40% increased incidence in Alzheimer's. You know, do I believe this? I don't know. But it's very interesting that now long-term studies are showing the drugs may not be near as safe as they preached. We also see, because of you don't have acid in your stomach, there's an article that came out recently of low B12. Your vitamin B12 is absorbed by something called intrinsic factor that's only activated when there's a strong acid in the stomach. The evidence is building that long-term chronic use may not be safe. None of these drugs are approved for long-term use, and almost everybody that's on them is an off-label use, meaning against the recommendations of the physician's death reference, the PDR book. They're only approved for 6 weeks, but yet most doctors will give you the medicine, and of course you can buy them over the counter. The warning's on the label, but most people use them for longer than what they've been approved for. The medicines also are interesting that if you try to stop them suddenly, it's almost like you're addicted to them because you'll hypersecrete or oversecrete acid for up to 3 weeks. So if you want to try to come off of them, you can't just stop them cold turkey or else you'll have some miserable days. It's recommended that you go to what's called a histamine 2 antagonist or Pepsid Zantac family of drugs and take those for a month. Reflux is an interesting disease because it's the only disease I'm aware of in medicine that we just treat empirically without a diagnosis. In fact, the American Gastroenterologic Society, AGA, says that 40% of people on proton pump inhibitors have no business being on. So this is a multi-billion-dollar waste of society's healthcare dollars with an expensive drug with significant side effects. Every mammal, from a mouse to a whale, has acid in their stomach. I mean, a vulture or a buzzard can eat rotten meat. Why? Because they have incredibly strong acid in their stomach, and it immediately kills anything that they eat. Without that acid, they wouldn't last a day. So the point is that we're coming full circle with these drugs, realizing that they're not necessarily safe to use long term, and other options should be considered. You have reflux. We feel it's critically important that you have an accurate diagnosis because there are a lot of people that are misdiagnosed. I've taken out gallbladders and cured people's reflux before because it was never reflux, and they'd been on Prilosec drugs for 5 years. You can have a stomach infection, H. pylori, which can mimic reflux. causes ulcers. You take the medicine, the pain goes away. You stop the medicine, pain comes back. They assume it's reflux. May not be. Types of reflux I'd like to talk about. One is the common one that everybody understands, is esophageal reflux. It's a large volume, high acid. If a person that eats too much, tries to lay down, take a nap, food comes up, that's esophageal reflux. And the symptom is usually heartburn. But there's a whole class of reflux called respiratory reflux. It's also called laryngopharyngeal reflux, or LPR. And some people call it silent reflux because it's usually associated with no heartburn. However, it's not very silent if you're coughing all day long or clearing your throat all day long. And it's not very silent if you can't talk and you have terrible voice changes. It can interfere with your professional life if you use your voice in your profession. The respiratory reflux is inflammation of these delicate tissues up above the top of the esophagus. The suffix itis means inflammation. Sinusitis, bronchitis, laryngitis, chronic sore throats, chronic voice changes, chronic voice issues, chronic throat clearance, chronic cough, asthma, recurrent pneumonias, pulmonary fibrosis can all be reflux. When I hear the term idiopathic pulmonary fibrosis, mean you got lungs that have turned to leather and we don't know why, I just cringe, because that's such a 1980 term. That is a totally preventable disease. You make the diagnosis before the lungs are destroyed and you prevent a lung transplant. So there are people who are literally being destroyed by their reflux and they haven't connected the dots. They haven't connected the dots. So what's your doctor not telling you? That your chronic cough, that your chronic sinus issues, that your chronic sore throats aren't strep, that it's reflux. We see dental erosions, the enamel being eaten off the teeth. There's a great article at the University of Kentucky where they laser mapped teeth and showed people on the anti-reflux medications with their symptoms controlled had documented loss of enamel on the back inside of their teeth. If it's strong enough to eat the enamel off your teeth, guess what it's doing to your sinuses and to your vocal cords and to your lungs? Probably 40% of asthma, it's not asthma at all, it's reflux. If you can't get the air in, but you can get the air out, that's reflux. If you can't get the air out, that's asthma. Simple little question. 40% of people having their lungs destroyed have something that can be fixed with a 30-minute outpatient procedure. So it's critical to make this diagnosis. Medicine has what we call silos of expertise, these little people who will do their things and they know a whole lot about it. The ENTs know a lot about the sinuses and a lot about the larynx and the vocal cords, but they don't know that much about the trachea, the lungs, the esophagus, and the stomach. GI doctors claim to know a lot about the esophagus and the stomach, but they don't know much about the sinuses, the larynx, the trachea, the lungs. Pulmonologists know a lot about the trachea and the lungs, but they don't have a lot of expertise in the sinuses, the larynx, and the esophagus. And general surgeons tend to be a mile wide and an inch deep. Very few general surgeons do their own endoscopies and understand the workup for reflux and do a good thorough job with that. So what's needed is a place where the diagnosis can be made. Michael Vaese, who is the chief of GI medicine at Vanderbilt, talks about the whirlwind of confusion. Patients with chronic cough, chronic sinus problems, chronic sore throats get sent to GI who scopes them and they don't see a hiatal hernia. They put them on an antacid medicine. They don't get well. They send them to an ENT who scope them and they say, well, gee, everything's red. It must be allergies. So they go to the allergist and they get allergy testing. Says, well, you're coughing. So they go over here to the pulmonologist and you get a bronchoscope and we don't know what the matter is. So you go over here to the psychiatrist and you go round and round and round. This is a $60 billion a year process, according to Dr. Vaese. And few of those people got a good diagnosis, and few of them got well. The lifestyle impact of Gerd on people is greatly underappreciated. There's a recent study that looked at that. They looked at the top 20 diseases of modern humans, and found that reflux has more of an impact on your lifestyle than even severe congestive heart failure. So this is not a minor issue. Once you get progressive reflux, and it's important, if you do think you have refluxes, get educated. There's some great websites. There is a test that you can take that you can figure out your stage, and that's very important, because if you're into the end stage things, your medicines are no longer going to help you. If you have chronic daily irritation of something, you will increase your chances of cancer. There's no question about it. That happens in every organ system. We cure 85% of colon cancer. We lose 85% of esophageal cancer. The colon has a tough serosa. My granddaddy made sausage liners out of it. The esophagus doesn't. Esophagus has got to be able to swallow and expand, so it doesn't have that tough outer coat. Cancers form in the lining cells of the organ, and if once it gets through the what's called the mucosa, it's immediately into the lymph nodes, lymphatics, and basically that person is going to die. The precursor lesion, or the thing that leads up to that, is something called Barrett's. And we feel like if you have Barrett's, you really need that evaluated not just with a biopsy every 1 to 3 years, but to stop the daily chronic inflammation and the carcinogen coming up. There's adequate data to show that Barrett's will reverse after a reflux operation, and that the risk of cancer in that Barrett's is reduced. It may not go to zero, so you'll still need some follow-up. But there's even ways of getting rid of the Barrett's with what we call radiofrequency ablation. And we've been doing radiofrequency ablation, or it's called halo Barrett's. We've been doing this from the initial study that was done by Dr. Nick Shening. So we have experience in that. We can make your Barrett's go away. It is something that I think will be, unfortunately, a major cancer killer in our next generation. The first adenocarcinoma ever described in the United States was 1952. It is now the number 4 cancer killer of men, and National Cancer Institute says if it continues at the same increase, it's going to outkill colon cancer and lung cancer by 2030. So this is a huge impact on our society. Dr. DeMeester, who is my mentor, recently published an article compiling all the animal studies on Barrett's and adenocarcinoma. And what he showed was that if you have strong acid, you get inflammation, but you don't get any precancerous changes. If you have strong acid in bile salts, you get some what's called columnar changes, but no Barrett's and no cancer. If you get weak acid up the esophagus with bile salts, if you follow those lab animals long enough, 100% of the time they got Barrett's and cancer. He ended the article saying, so goes the rat, goes the human, meaning that we are creating a low acid state, and if you have bile salts backing up from the duodenum into the stomach, you're having potentially carcinogens coming up, being absorbed, and it's the weak acid in bile salts that are causing the Barrett's and the cancer. So PPIs do not protect you from Barrett's and cancer, and they may very well be the cause. There's a lot of research, as you can imagine, being done on this right now. Our modern lifestyle with what we call the Western diet, it's a low-fiber, higher sugar diet than our predecessors ever ate. And if you eat that diet, your chances of reflux are increased. Your chances of having reflux are also increased by your heredity. If your mother and your grandmother and 2 uncles and a grandfather all had reflux, odds are you're going to be at risk, because the way you've inherited your anatomy makes you more likely to have reflux or not. It is a mechanical problem when it gets down to it. We think that when the following things happen, you should seek advice about getting your reflux repaired. If you want to get off your medications, you've been on them for 5 or 10 years, I think that's very reasonable. If you're starting to have symptoms at night with a valve so weak that stuff's coming up while you're asleep, I call that the pop-ups, pop-up gasping for breath with stuff coming up into the back of their throat and their nose. Medicines aren't going to help that. That person needs to consider getting it fixed. If you're starting to have end organ damage, Your lungs are being injured. Your sinuses are being injured. We see people who've had 2 or 3 sinus operations and they just hadn't connected the dots. The reason they got chronic sinus problems is because they're having digestive enzymes and acid come up into the back of their throat and into their sinuses. If you have a chronic cough, we can do what we call symptom association probability. We can do a pH monitor and have you push a button every time you cough. And I tell people, don't come in with less than 100 button pushes. If you come in and you've got over 100 recorded coughs, and over 95% of them had an acid event right before you had the cough, then your chances of losing your cough are essentially 100% if you get your reflux fixed. In the past, we had just the Nissen fundoplication, the so-called wrap. It was a one-night stay in the hospital. You had to take the top of the stomach down and wrap it around the end of the esophagus. And when the stomach filled up, that pressure was placed sort of like an on-demand blood pressure cuff. It's a very effective operation, but it's extremely effective, and it has some baggage. You don't throw up well afterwards, and that's an issue. We now have the Lynx, the magnetic bracelet. And the Lynx is wonderful technology. It can be put on totally as an outpatient. If you have a hiatal hernia, the hiatal hernia is repaired at the same time. The Lynx in studies is showing just as good a reflux control as the wrap, the fundoplication, but without the baggage. The device is amazing. Magnets never wear out. As long as there's a North Pole, they're going to work. The studies are interesting because each year the results, if you keep following them, get a little better. There's no other medical device that you can say that about. Heart valves don't work better. Knee joints and hip joints don't work better. They tend to wear out over time. So we're extremely excited about the Lynx as an answer to getting people off of their medications and getting their life back. I mean, if your life is dominated by your reflux and your reflux symptoms, get your life back. If it's a mechanical problem, get it fixed. If you'd like to find out more about your reflux and what can be done, go to southernrefluxcenter.com.